Well, good morning, good afternoon, good evening, everyone. Welcome to this very special event, part of the formal side events of the UN Summit of the Future Action Days. And we're coming to you live from New York. I've got to say, I've always wanted to say that. Coming to you live from New York. And we're being live streamed around the world on our YouTube channel, on Facebook, and of course, LinkedIn. A big welcome to subscribers of A Shot in the Arm podcast who are accessing this, listening and watching via their favorite podcast platforms. So we're here at Langone Health at New York University, just down the road from the UN on First Avenue. And first up, a really big thanks to everyone at NYU, particularly our tech colleague, Andrew, who has been invaluable in making sure everything runs smoothly. Also, a big thank you to the Belgian mission. We'll be hearing from them in a little bit, to the Nigerian mission, and of course, our friends at UNICEF. So we're here today to launch a new report from the Global Listening Project on how 18 to 24-year-olds around the world coped during COVID and coming out of COVID, and what it means for the future. And it's a mixed bag. And we have an exceptional panel for you today to help reflect on what this means for our collective futures. And I'll introduce them and ask them to make a quick intervention. So first up, friend of the pod and great colleague, co-founder of the Global Listening Project, it's Professor Heidi Larson. Heidi, welcome.
Thanks, Ben. I know this is a 1-minute hello, just to say thank you to everybody for coming. We'll run a few slides after to set the scene. I'm Heidi Larson. I'm actually professor of anthropology, risk and decision science at London School of Hygiene Tropical Medicine, and also at the University of Washington Institute for Health Metrics and Evaluation. An old UNICEF colleague for many years, so I'm happy to see my extended family back. This project, the Global Listening Project, grew out of 15 years of what I founded in 2010 called the Vaccine Confidence Project. And during those 15 years, looking and trying to investigate what are the reasons that so many people are questioning and hesitating about vaccines, we understood a lot about trust. And actually, a lot of the issues we were uncovering about vaccines were very relevant to other kinds of health interventions and issues and trust in institutions. And we went broader with the Global Listening Project in the context of COVID, when there were many things that people were asked to comply with. So just really happy to be here. This is the first of a series of issue-specific reports. We did a major 70-country study, which was too much to pack into anybody's backpack. So we thought we'd roll out the chapters. And in the context of the Summit of the Future, the UN had particularly asked us to focus on this age group in this context. Thanks, and really look forward to the discussion.
Brilliant, thank you. Next up, another friend of the pod, New York City Public Health Commissioner, in fact, Dr. Ashwin Vasan. Ashwin, welcome back, and thank you for the city of New York to host us all here in this crazy week.
Yes, it is indeed a crazy week. Take the subway if you can. Try not to drive. Welcome. For those of you coming from abroad, welcome to New York. I'm Ashwin Vasan. I'm the New York City Health Commissioner. I've been in this role. I was appointed at the end of 2021 and been working in this role since 2022. I'm very glad to be here today to talk about these issues in particular, and I've been a big fan of Heidi and her work for many years, in part because we're getting down to, and she's been getting down to, the essence of what makes our job in public health either easier or less easy, which is our ability to create and hold and maintain trust with the public. And I think we've all, I don't need to belabor the point that public health has taken a huge hit writ large in public trust in the pandemic era. And I'm particularly interested in ways to build up and build back that trust, because despite the challenges that public health faces, poll after poll, at least in this country, but I imagine it tracks globally, is that health professionals and doctors in particular still maintain extremely high levels of public trust. So how do we leverage that while translating that to our institutions, to the way that we make decisions? And I think often it does come down to both listening and explaining our thought processes and being willing to say, this is what I know today, and this is what I know tomorrow, and my decisions might change tomorrow from today. So that's the context in which I come to this work. The second thing that I bring and that we bring as the city to this is a focus on mental health, and particularly youth mental health. I'm so glad that this report focuses on 18 to 24-year-olds, because while we face incredible division and divide in our perceptions of trust and in institutions, and frankly in each other, shaped by older adults and people in their middle age, it is this generation that will determine the future of our civic infrastructure, whether that's public, private, philanthropic, nonprofit, and whether we're able to marshal those resources together to solve big global challenges or even domestic challenges and local challenges. So I think listening and getting down to the details of what is causing young people anxiety, what's causing young people to feel hopeless and sad, and focusing on mental health as both a byproduct of those feelings and also a foundation to more positive and optimistic view of the future is central to the work that we do in New York City. And so glad to have these global data here and also the New York data. I'll say lastly, one of the things that I love about this report is that they're able to do granular research in ways that sometimes government struggles to do. And so this is a nice complement to reports that we've put out recently. State of Mental Health report, first of its kind in the country and for this city in May of this year, and a social media report, survey report that we issued in June. All of those are available on our New York City Health website. So I'm glad to be here.
Brilliant. Thank you, Ashwin. And a tall order, the generation that's going to define the civic infrastructure for the future. Well, our next panelist, again, a friend of the pod, from a non-profit organization called the MTV Staying Alive Foundation that knows intimately how to engage and communicate with young folks around the world. Wame Jallow. Wame, welcome.
Thank you very much. I'm really excited to be here. This is a really great opportunity and a chance for us to reflect on many of the points that you've raised on things that impact young people and how to really make sure we can communicate it in a very deliberate and clear way. So many of you may be familiar with MTV Staying Alive Foundation. We're known for flagship programs and media campaigns that we've held over the years. MTV Sugar and also In Bloom, which reflects the lived experiences of young people around sexual reproductive health issues, family planning, and even COVID. So we'll be excited to share some examples of how young people have reflected the gaps and issues around anxiety, depression, mental health issues, and we're able to put it on screen and demonstrate like some of these issues that young people encounter. With that, I'll hand over to Ben.
Thanks, Wame. And as a great leader, taking control of the stage, that's what we want. And last and by no means least on the panel, we have Dr. Viorica Berdaga from UNICEF. And Viorica, it's a real pleasure to have us here. Thank you.
Thank you, Ben. Thank you, colleagues. It's a real pleasure to be here as well on behalf of UNICEF. I think many of you have heard about UNICEF. UNICEF is a UN agency mandated to advance and protect the rights of all children, wherever they are. And we are keenly following and using the data that have been that were generated through the earlier vaccine confidence project, and now very excited to see the new data that are generated by the Global Listening Project. They are essential for us because among many things that UNICEF does for children, we are also looking at the uptake of the vaccination and essential health services, especially in crisis. And as there's an increased focus on young people, and as they are critical, as many of you have stated, for the future of this city, of their countries, of the global, of all the countries in the world, I think it's very important for us to understand what builds their trust, how it interacts with their decision making, and how it allows the countries, the states, the service providers, the programmers, communities and family to engage and interact with the decision-making processes and support services for young people. So happy to be here. Thank you.
Lovely. Thank you. Thank you. Now, there are two further introductions that we have. New York being New York during the UN, it can be sometimes hard to get to meetings on time. But I'm delighted that the representative from the Belgian mission is with us. I'll let you get settled and sorted, and we'll come back to you in just a second. But first, we have one very special connection live in this live stream from South Africa, where youth activist and vaccine advocate Waisha Raphael, who's known to a Shot in the Arm podcast and the Global Listening Project. She wasn't able to make it here in person. There's always a challenge when it comes to the US consulate in Johannesburg, but that's for another day. But let's go live to Johannesburg, to Midrand. And Waisha, are you there?
Hi, can everybody hear me?
Yes, hi. So over to you to give some contextual comments as we then get into the GLP report.
Thank you so much, Ben. And as always, I'm missing you guys so much all the way here from South Africa. The weather is cold, but we'll manage. And I hope everyone is doing well out there in New York. So as Ben said, my name is Waisha Raphael. I'm a production coordinator at the Global Listening Project, as well as a Shots in the Arm podcast. I am first and foremost a youth advocate and activist, focusing on comprehensive sex education for youths aged 16 to 25, and particularly passionate about HPV and its little discussed effects in Southern African communities. I obviously am a youth myself, a young 24-year-old, and therefore truly understand the need for youth voices to be heard and collaborated with in spaces such as this one. As I have always said, nothing about us without us. You can discuss us and our peculiar ways, as research always recalls, but if we're not a part of those discussions, no effective solutions or understandings can be made. According to UNICEF, young people are more skeptical now than ever about vaccines than they were before COVID-19. And the discussion around trust is a great example of this. We young people are very aware that we are being monitored and researched and discussed. We are patiently waiting for you all to see that we know and invite us to the table so that we can all discuss together. COVID-19 had a huge impact on us as young people from all over the world, from bigger picture issues like mental health to finances, to seemingly trivial things like losing prom and graduation. We lost a lot, but we also learned a lot. We have already made our own safe spaces and communities online and in our third spaces all over the world. But in order to make real changes, we need resources, and those honestly come from you. So I'll end it off by answering the two questions that we've been posing to everyone who's been coming across the Global Listening Project and my content creation booth, which is, who did I trust during COVID? And as I've always honestly said, Google was my best friend, but also my online communities in which people shared their personal struggles and experiences. But the next question being, who would I trust if another pandemic or something similar to COVID-19 were to happen again? Once again, my online communities, the real people who share their stories and experiences with people all over the world from their little screens from home. But anybody else, like the government, like Google, like the internet, it's becoming harder these days to trust those sources. And there's a lot of reasons for that I'm sure is a long discussion, but that is my answer. And thank you so much for the platform. Ben did tell me that there's not going to be a lot of young people in the room. So I hope that what I've said is going to give a little bit of context about how young people, maybe just from my small corner of South Africa, are feeling. Thank you, Ben.
Thanks, Waisha. And in fact, we do have a few younger folks here. And, you know, a podcast with me wouldn't be a podcast if I didn't quote the Pet Shop Boys.
Yes.
And a song from the 1990s, which goes, "I've been a teenager since before you were born." So with that, we have one further set of introductions to do. And I'm going to jump down and invite Ms. Heidi Rutz, who is the Director General for Development and Cooperation and Humanitarian Aid for the Government of Belgium. And we are absolutely thrilled that you were able to make it, Heidi. So come on down and give us your thoughts. Yes, please.
Okay. Thank you so much. And I think referring to the Pet Shop Boys indeed unveils a little bit about age. But very happy to be here with you. I'm indeed acting as the Director General for Belgium. And I think we are very often in our jobs dealing with all these geopolitical big questions. And these geopolitical questions about instability, conflict, pandemics. We as Belgium, we have a lot of work also on global health, and we've really underscored that during our EU presidency, together also with Heidi and Peter, worked a lot on these issues. And what I think is important, what we realize in our work is indeed that connection between the geopolitical challenges and the realities, the connection between what is happening in the world and the impact on mental health. And I think very recently, I think it was about 10 days or maybe 2 weeks ago in Belgium, there was an article that honestly really shocked me. I'm from probably more the Pet Shop Boys, right? Generation. I wasn't clearly that big a fan. But I have children within an age group where I read figures that really shocked me. Figures of the ratio of suicide in the age group between 25 and 40. We're talking about Belgium, is 25% of suicide. That really shocked me. And then in the article, it said that what are these people concerned about? It's 4 things: energy, war, health, and climate. Those are the things that we are dealing with in international cooperation. And so indeed, these bigger topics today here at the high level week at UNGA are having a real reality on the mental health of our people. And so I think it's really important to make that connection and also to invest in international cooperation to tackle these things, because it's not just about faraway things, it's about close to our heart things and impacts. So for us, what is important is participation and empowerment. It's not about giving voice, it's about listening to the voice of young people. And it's about listening to the conversation where mental health issues and trust issues are being discussed. The voice is there, the knowledge is there. It's about integrating it. And secondly, is really also how now to make that relevant in all policies. All policies, for example, also humanitarian. I'm responsible for the Belgian humanitarian aid. We have actually an SDG advocate, a wonderful SDG advocate, Her Majesty the Queen, and she's particularly involved in topics of mental health. And Belgium will also organize a conference in November this year, and also the topic will be discussed later this year in November. So for us, it is important. But as Waisha said, nothing about us without us. So if you allow me so, I would like to invite Sean Nart, one of our youth delegates for Belgium, it is actually important to come to New York with youth delegates. And I would like to give him the floor exactly because of that reason. Nothing about us without us. Sean.
Thank you very much. So to elaborate a bit, I'm also 22 years old, so I'm just about right to represent youth, I think. But yeah, as you said, to elaborate a bit more, youth participation is key because I think, and Youth Council in Belgium will say the same thing as me, that we are vector of change. We are expert of our own lives. We know more about us than other people. And sometimes we are not listened to, which is a big problem. And yeah, to elaborate a bit more about the impact of COVID on Belgian youth, maybe a reference from the Flemish Youth Council that said that in a survey that half of the people, young people surveyed, said that COVID had a negative impact on their mental health. And yeah, as you said, other surveys said the same thing. It is very important for us to be able to have positive perspectives for the future. And I think that yeah, being able to participate in such events will gladly help us. Thank you very much.
Thank you, Sean.
And thank you, Heidi, and thank you, Sean. Which brings us to our other Heidi. And now is the time for us. And now is the time for us to look at this report and hear from Heidi the findings and her insights into what the study tells us.
I just want to add an additional thank you to Philippe from the Permanent Mission, who has been hugely, hugely helpful through these process of navigating the many things to make this part of an official part of the program. So thank you. You've been amazing. And the other Belgian, my husband, Peter Piat, has been my full soul support throughout this 24-hour a day, because sometimes project, not quite 24 hours, but too much, so much, I should say. Anyway, I just also want to call out our funders who also made this possible. The original funding for what became the Global Listening Project was the MacArthur Foundation, which was in 2021 out of a special fund set up to address inequities and injustices in COVID recovery. They were already in 2021 thinking about recovery, not knowing this was the beginning of a much longer wave. GSK, who also loved this project because it wasn't specifically about products, it was about the broader trust environment. Moderna also came along because the trust angle was so important to them. And the Bill and Melinda Gates Foundation that came and supported to make sure that we kept a good focus on the gender implications, because there were a lot of gender implications and it really varied by country. It was very different. In overall, I have to say that women and young girls had a slightly higher reporting rates of mental health issues and loneliness. On the other hand, that flipped in a few countries. Nigeria, for instance, it seemed like young men had really struggled, and some of the young girls were a bit more better with self-coping, but it varied by country. And one of the things we look forward to moving ahead is doing deeper dives and country profiles to understand what these issues were. So next. So just to kick off, I just have a very few slides and they're selective. We have a lot more and it's all on our website, global-listening.org. But one of the introductory set of questions we had was on their perceptions of how the COVID pandemic, how the government handled the response. And we had, as you can see, it was a big range. And I've been doing this past year. This data was collected, by the way, the 70 country data was collected between July, August, and September, mostly in August, September around the world. The city-specific data in Tokyo, New York, and Atlanta, that's also in the report, that was just conducted 4 months ago. So that's showing us that things are not necessarily getting better when it comes to mental health. So a huge range here. One of the big things we learned in having roundtables in a number of countries, asking for people's response, what do they think about this data? We realized that people were not judging the government response based on how well the government kept the case count down or the death count down. What they cared about was, how did the government consider my well-being? You know, is my kid gonna be messed up because of the school regulations, my job, my livelihood, my relationship? In some places we said, you know, in Sao Paulo, a lot of people talked about, you know, the stress on homes, broken relationships. In Nigeria, their top concern was food security. So people wanted a much more, their judging of their government, and I think this is an important message for policymakers, was, did they think of our overall well-being and not just keeping the virus numbers down, the cases down. So I'm going to jump ahead specifically to the 18 to 24 and just show you this one slide. Globally, the average for the 70 countries was 40% of the global population. That's over 70,000 people that we interviewed. The average of 40% reported loneliness or social isolation during the pandemic. Again, that varied by countries, but that compares to 52% of the 18 to 24-year-olds reporting that this was a big issue for them. And again, that varied. What was interesting in Africa, it was much closer, but that was because more adults reported isolation and loneliness also. Next. And then, as I said, you know, we're really looking at the 70 country landscaping to see where numbers stand out, and we do local roundtables and socializing of the data to get feedback, to get the stories behind the data, which is the interesting part, actually. And we're doing some deep dives because one of the sub-themes in this work is big cities, because cities, even though there are a lot of people around, there's some of the highest levels of loneliness and isolation. And I mean, Ashwin will we'll talk a bit more about that. But this is New York, Atlanta, and Tokyo. And partly picked because of some of the things that got flagged during the larger study. But as you can see, it reflects a year later, I mean, this is 2024 data, that this 18 to 24-year-old age group clearly reported the highest levels of anxiety and depression. It went down to all the cohorts. It started to go up again for over 75. Particularly in New York on the depression side, and more in Atlanta on the anxiety side. Next. And then the other thing we looked at is, it's one thing to say there was a lot of mental health issues reported and loneliness as one, anxiety, depression were others that we probed. But then how did it impact on your life? And the question we asked was, during the past month, did you have any problems with your work or daily life due to feeling depressed or anxious? So this was trying to take it a step further to see, okay, you had this problem, but are you still functioning, or how well are you functioning? And again, we had the highest levels among 18 to 24-year-olds, particularly in New York, but then actually it was interesting, in Tokyo, the numbers started to going up for over 75. That's disproportionately, the population itself is aging Anyway, so these were just glimpses to give you a sense. There's a lot more data. If you go onto our website and click social preparedness, societal preparedness insights, it takes you to an interactive website. You can click a country, you can click a question, you can click an age, a religion, a rural, urban, we want to make sure it's open access public. That's it for my overview. Thank you.
Lovely. Thanks, Heidi. So would love to get the reactions of the panel. Ashwin, if I could start with you. In your opening introduction, you said how glad you were to see some New York deep dives in here. But does what Heidi describes resonate with your experience?
Very much so. And in many ways validates the data we've collected in the two reports that I mentioned, and goes deeper into some of the causal factors of what's really ailing young people. Just a few data points to offer corollaries to this. In 2021, so end of 21, been through the two hardest years of the pandemic, 38% of 18 to 24-year-olds said that they were so sad or so hopeless and had lost so much faith in the future that they had just stopped doing their usual activities, which we would say clinically is called anhedonia. That's profound. But we said, okay, that was situational. Maybe it was situational. We were still at the height of the pandemic and things were not going very well, and a lot of trauma and tragedy, particularly here in New York, right, where we lost 50,000 people, half of which happened in the first 3 months. For those of you who were here, it was an extraordinarily difficult time for all of us. But we did a survey in 2023. This is the one we published in May of this year and June. And what it shows is that things are still, while overall things might have improved slightly, for young people, the data is concerning. 50% of 18 to 24-year-olds reporting that they have moderate to severe symptoms of depression. Similar rates of hopelessness and sadness. So very important insights from this report to complement those data. These are official government data, right? For the city of New York. Very important granular complements to these data to start answering the questions of what is driving this for young people. And I think that first insight is profound. It wasn't how the pandemic was handled with respect epidemiologically, with respect to morbidity and mortality alone that is driving and that drove people's confidence. And that, I think, if we have something to learn in public health, we have many things to learn with humility. It's that for the next pandemic, we must take into account the wide-ranging impacts of our measures, our mitigation measures. We must understand the ripple effects, both short-term and long-term, on the most vulnerable, including particularly our young people who are at very fragile social, emotional, neurological points in development. We have to understand how our edicts, our rules, how powerful those are, of course, comes with great responsibility, but how we must position those edicts in an information ecosystem that is so deeply fragmented. You know, I like to call it the misinformation superhighway, because it's really a conduit for so much data and very hard for the average person to discriminate what is true. So I think this is very powerful data and shows some very powerful directions for us to begin to rebuild the trust that we can see across the world is eroding, has eroded. And I do believe that there are steps we can take today for those of us in positions of leadership today to start to signal that we're making a shift. But one of the ways we can do that is to open up places and spaces for young people to step in and address these concerns directly, and to take over these same institutions, these complex institutions that we lead, solving complex problems. Young people really do need to be at the table addressing these concerns with us. So one thing we did here in New York in the wake of the pandemic was to set up a youth mental health advisory council. And there's many advisory councils, we can all agree. You can put people in a room and get them around a table and serve them pastries. But we are really gathering important data about not just what we're focused on, but how we're doing our work. Who are we talking to? What is the follow-up that we have and do with young people and with communities? And it has changed our approaches. It has really fundamentally changed the way in which we stay in dialogue. It's not a performative checkbox, but rather a constant back and forth. And what it has done is thickened our skins to be able to hear real feedback. But also, what we hear is positivity too, because all people want at a very basic human level is to be heard, to be listened to. And I don't think they're expecting perfection from their institutions. They're expecting dialogue. They're expecting openness and some transparency and trust to be given to them. So I think we will get that back in spades if we just are a little less insular, a little more open to dialogue, a little less risk averse, frankly, a little more brave, a little less precious about how it makes us feel, a little less territorial, and a little more open to hearing from the public, particularly young people, about how we're doing.
Ashwin, and given everything that's going on this week in the UN and the difficulties getting the Pact for the Future signed, there is, of course, an alternate worldview that says we're not interested in us listening to you. You have to do what we say. And the issue is about your inability to do what we instruct you to. So I think what you were saying is really profoundly important, not just for New York, for the States, but for the whole world. Wame, if I may come to you and your reflections on Heidi's data.
Thank you. So first of all, I just want to say big congratulations to the Global Listening Project for this brilliant work. I mean, one of those challenges that we've seen is that there is lack of data. So the fact that we were able to collect this information that really reflects lived experiences of young people, I think is really phenomenal. And it really bridges a gap that we're seeing globally and from a data perspective. But what it also does is it triggers dialogue, which is really fantastic. I think we need to be having more of these conversations with young people and led by young people as well. We know this as MTV Single Eye Foundation because much of our work in storytelling starts with actually collecting stories from young people that reflect their lives. So they tell the stories and it's captured on scene. And this is quite powerful because it's using media, is using a tool that sometimes can negate some of destigmatize some of the hard issues. We've been very popular for putting some very controversial issues on live TV and prompting conversations amongst young people. And as Waisha said, creating a community, because in that community of young people, a lot of the issues will come out. We saw this quite a bit for us as MTV Single Eye Foundation when we produced our TV series called MTV Sugar Alone, MTV Sugar Alone Together. And this came out during COVID because young people were isolated, as you said rightly in your report. They were living behind closed doors. They were unable to share the experiences of what it meant to be confined in this kind of context and the anxieties that they had and who they dialogued. So it was a mini series that was in 4 countries, and it allowed for young people to blog, to actually share short clip videos, to prompt a community of conversation. And it really helped deal as a coping mechanism. So a lot of what you said, I think, is quite critical in terms of how we can bring up the issues. But the one thing that we also need to consider is how we giving young people the tools, like for example, access to services, the preventive methods that actually can help negate some of the challenges that they're seeing. It's one thing to raise awareness around the issues. It's another thing for young people to have no place to go to cope and to deal with it. And how do you create those psychological safe spaces? So this is really brilliant. We're really excited to have this, and we're hoping that it can really prompt a call to action to really consider what are the barriers for some of the young people as it relates to these issues. What is a call of action? What kind of policies do we need to change? What kind of information? How do we use media, which is a very powerful tool, to be able to communicate what young people are seeing, their lived experiences? So all of this resonates, and I'm looking forward to the rest of the conversation. Thank you.
Thank you, Wame. Viorica, UNICEF is basically the go-to for information globally about children, but also youth, which, depending on who you talk to, can even go up to the age of 30. And I just wonder how the data that the GLP are launching today, how that ties in with what you have seen.
Yeah, thank you for the question. Definitely, the GLP findings, they validate, but they also add and expand on the evidence base and what we are hearing from children and young people. And what I also like about this data, that it advances the measurement and the understanding of the issues of trust and what it takes to build resilience and coherence in societies, in families. And these are notoriously difficult issues to measure, to understand, to deal with. So that's a real added value of this research. Also, on the practical side, I find it very helpful to see who the young people would turn to in the case of the crisis or the next crisis, who they trust to, because that allows us to develop programs that could be more effective and reach a bigger number of people. It also validates the magnitude of mental health issues that we are seeing. You may know in a couple of years ago, UNICEF launched the State of the World Children on mental health issues. UNICEF highlighted that about 13% or 86 million of adolescents are affected by various mental health issues. And of course, it varies across countries, as all the data that we're also seeing from this report. And yeah, this is massive. That has massive implication. I think if you look even in terms of economic cost, we've estimated that it costs approximately $390 billion, which is annually, which is a staggering figure on human potential that is lost due to mental health issues and suicides. And I think that was mentioned several times here. So, but again, I liked very much the expression, nothing about us without us. So I just wanted to say that UNICEF is also making it a practice. It's a standard practice with UNICEF to consult with young people and hear what they say. And we've conducted also a study of 13-country study with more than 71 actually, focus group discussions on what are those challenges that adolescents are experiencing, and how these are shaped by which factors these are shaped and how they are coping. And this very much validated by the findings from the study. And so what we are hearing from young people is that first of all, they find that mental health issue is a taboo and embarrassing topic to talk to. It's often stigmatized. Often they cannot find the right language to describe how they feel, and of course we were focused on a younger age group. I just want to stress it. It's like under 19, so years of age, which is slightly different from the age group of your report. Nevertheless, what it meant that very often children and adolescents had to keep those issues to themselves, and they had to deal with them themselves. They felt lonely and they felt isolated, and they didn't feel they had enough support. And I know that we may be going into the solution a bit later, so I won't go into this now. But just to say that how important for them is to have that support in the context that they live and how they experience their lives, which also very much resonates with what you brought up earlier, Heidi, that people assessed the government not by the effectiveness of their public health actions in terms of reduced deaths or whatever. They judged them by how well the governments were able to respond to their broader needs. And that is coming very kind of similarly in the findings that and what we hear from young people.
Thank you, Viorica. Now, our next section was going to be precisely that. So what? What do we do about this? And I think a number of you have already touched on what that might look like. But Wame, I wonder if I could come to you first. And, you know, MTV Sugar has been producing shows for young people across Africa and India for a good few years. As you start the next wave of sugars and In Bloom and sort of online communications, are your messages changing given what's happened to this generation? Are you having to think about how you engage with them differently?
Thanks, Ben. That's a really great question. So the first thing I can say is that because the stories are told by the young people, they really come from that perspective. So they're getting bolder in telling, I think, some of the issues that a lot of times we contend with. They're also getting quite keen on actually creating the content themselves. And I think that's also what really critical, that this is not the rest of our generation coming in and dictating the way that the content should be created. It's coming from young people, and I think that's really powerful. So they're building the capacity using phones, using social media in more innovative ways, using digital media approaches in more innovative ways. So the young people now are taking the mic. They're actually now the ones telling the story, and they're using digital platforms to do that. And I think that's quite powerful. It puts us on the edge of innovation. It gives us real-time information and reaction from young people, but it also gives a collective story, because usually you hear information in isolation, and for the first time now we're actually seeing in different media platforms, whether it's Facebook or TikTok, a difference in the way that the messaging is coming out. The other thing I would say is there is a change as well in the way that young people are engaging with content. So, historically, and I like what Waisha said, Google was my best friend. Now we're seeing a lot of young people saying, okay, I need to understand this issue first in 30 seconds. So I'll go onto TikTok, learn about the issue, and then take it from there. But we're also seeing how they're using that information to share with other communities as well, teach and educate other young people. So the complexities, I think, are growing. We're seeing much more complex ways of young people expressing the issues. But all of that is founded from the fact that young people are now bolder and have more courage, and they trust their spaces and information sources to be able to share their stories. Thanks.
Thanks, Wame. And I think, we are seeing a holistic approach, a holistic set of challenges and opportunities. Ashwin, you spoke from the public health component around what you were doing next. I was interested, given the impact on young people in education, and now our 18 to 24-year-olds are either coming into university or further education, they're moving into employment. To what extent has the city's approach factored in, other sectors like education, like sport, and well, indeed, any other areas?
Very much so. Our philosophy is that any institution, any adult who's touching the lives of a young person needs to have a baseline level of understanding of how to engage that young person in dialogue, particularly around their well-being. So whether that's mental health first aid trainings that we do across our city institutions, we are doing suicide prevention training for teachers, administrators, school officials in all of our public school system, which is the largest public school system in the country, over 1 million students. But part of what we also have to do is to offer real conduits for young people to express themselves, not just publicly. So I love what MTV is doing in that space, but also privately, spaces where they can begin to heal, begin to get help. And so highlighting two things. One is our program Teen Space, NYC Teens Space, where we made free online therapy available to every single New York City teenager, 13 to 17. We launched that last November. 20,000 young people have signed up, which is pretty profound in less than a year. 67% report some improvement, and 60% of those young people are coming from low-income communities, Black and brown in particular, Black and Latino New Yorkers in particular. That's wonderful. Why? We have a real issue with access to care in this country broadly, but mental health care specifically. It's it's extreme in this city, where 60% of behavioral health providers are actually in the private sector, which means cash and carry. You have to pay every time you see one, which is not feasible for most people. And so offering up the recourse of saying, I know where to go. I'm meeting them where they are in a digitally native age group. We are pairing them with licensed therapists, so it's not only peer-based, it's real licensed counseling and therapy. And it's a front door to a system that can be very hard to navigate. So if you are in that subset of young people who have greater needs, more extreme needs, you're in crisis, that therapist can get you where you need to go. So it's not a panacea, but it is a start of democratizing access to mental health care. And let me say, it's very interesting to see what young people's major complaints are. Yes, many are saying, I'm feeling depressed and anxious. But in the top 3 complaints or top 3 reasons for seeking therapy is to try to be my best self. In the top 10 is to navigate relationship issues, school issues. So it's not just about I have a diagnosis or I'm having impairment in function that I need to get right. We over-medicalize and clinicalize mental health at our peril. It's simply the growing up in a strange and ever-changing and digital world where young people want to learn how to navigate and they need support in doing so, and adults haven't always been there for them to do so. In fact, we don't know how to navigate this world all that well either. So Teen Space is a stake in the ground, and I think will point the direction for the future of how we can at least start the process of meeting young people's needs in a very real way, in the way that they want, when they want, how they want.
Yeah. Viorica, both from the UNICEF perspective, but as we were talking in prepping this session, your own experience, you were in Uganda during the lockdowns. How are you all seeing the impact on young people's attitudes to their education, to their socializing and mixing with their peers and friends?
Yeah, that was a difficult time. And I'll briefly refer to my kind of personal experiences. My family and I, we lived in Uganda during the pandemic, and we have a young son. At that time, he was 10, 11 years old. And when pandemic happened, Ugandan government imposed significant restrictions leading to isolation, which meant actually not only closure of the borders and lack of any flights out of the country, but also closure of schools. So closure of schools was something that I think Uganda had the schools closed for 3 years. And all the children had to stay at home. And for about a year and a half, nobody was allowed to move around, which meant most of the children would stay within their houses. So we thought our son was doing very well, and at that point in time, because he was all the time in the apartment. So we lived in an apartment, which wasn't a New York size apartment, but it was an apartment, and only occasionally getting out and seeing his friends. And when I say occasionally, it really meant maybe once a month, once every 2-3 months. So doing educationally and academically very well, but on the communication or face-to-face communication, that was a challenge. And while we thought he was doing well when the measures were relaxed, as parents, we observed that his social skills, he wasn't eager to go back to school, and he felt he was doing fine and he had no needs to communicate with others. And of course, it took time for him to go back and to heal. And for us as parents, we were a bit concerned about that, and he's fine. And now he appreciates. But there was a time at which I was seriously kind of concerned about that. And actually, I was the only one who was getting from house several times a week, because I had to, at the time, I was the chief of child survival and development with UNICEF in Uganda, and I was interacting with the Ministry of Health almost on daily basis and coordinating UNICEF's response in Uganda. But now going to UNICEF's data, like how does it tie to UNICEF's data? And UNICEF has collected and published quite a number of data in several reports on how that affected young people. And the school closure was a massive one. It affected 1.6 billion learners around the world. I mean, if you think the total population, that's a lot of people. And when the schools are closed, I mean, many governments, it affected almost all the countries at a certain stage for a shorter or longer period of time. They've instituted some time of distance learning. It's at best, it's some sort of replacement, but not many families, especially not the ones without means, were able to assure access to distance learning. And children, actually that had an impact, psychological impact on children, because children lost their touch with their peers, with their teachers, with their friends, communities, and they felt lonely and they felt isolated, which is exactly what these studies showed. What among the other findings, I think the achievements dropped, and I know that we had some children and young people missed their graduations and missed, but the achievement drops on a more kind of even, I mean, serious, not more serious, because everything is serious actually, and that just longer term consequences we can see through this loss of learning and development. But on another note, child labor increased, adolescent pregnancies increased, violence against young people and adolescents increased. So all of these statistics kind of went up. And some families lost the loved ones, lost source of income, which put additional strain. So all of these pressures led to significant implications on the psychosocial behavioral development of young people and ultimately on their well-being. I just wanted to end by saying that COVID-19 pandemic, it's just kind of raised huge concerns about mental health, and but it's just maybe the tip of the iceberg. It was there before, it is there now, and we need to also look in the future, and we need to deal with those issues more comprehensively and look at the people's needs, children's needs, young people's needs in a more holistic manner.
Thank you. And COVID being the tip of the iceberg, I think, is precisely what drove Heidi to found the Global Listening Project. Heidi, you've been making copious notes as people have been speaking, and I wonder if you have any reflections on what you've heard, particularly as we think about trust in technology, some of the newer tools that are available to us, both opportunities and indeed challenges.
Yes, it's really it's really helpful for us to be hearing that the nature of your different research and interactions we're not alone with what we're seeing, but you're giving much more of a face to what some of the numbers that we have showed. And I really look forward to following up with all of you, because our larger report will put these faces on more clearly. Um, I think also what really struck me when you first told me about the reasons that some of these young people were coming for the counseling was how they could be a better person, or how they could do better in school, or and what the whole. And I'm leading a commission now, a Lancet Commission, on the emotional determinants of health. And we've purposely called it the emotional determinants of health because there is this space that's about emotional states that are in, that's not clinically mental illness, but is a really tough space. And in fact, one of the things that we discovered in our research when I showed in some roundtables, for instance, in Tokyo, that I said, it's really struck me that they reported some of the lowest scores on how their government responded, and yet they had the best in terms of, COVID outcome, very low case count, very low mortality. And also on mental health, they reported low. Now, we know in surveys that the Middle East, particularly the Gulf states, tend to report higher in surveys, and Japan tends to report lower. But despite that, we asked, and in this roundtable, which had Ministry of Health, the tech industry, pharma, NGOs, a real mix, 2 young women spoke up and said, and this also picked up from the conversation, we don't really have the language to talk about mental health issues. And we just, like my online friends in New York, have no problem talking about them, but they do actually. But just in terms of language, it's okay. And also, we're raised to pull up our bootstraps and just keep going. But then one of the senior people from the Ministry of Health was there and raised his hand and said, we had a real problem with mental health. We had a significant spike in young girls' suicides. And the biggest reason, that in the notes they left, or in what, in interviews with the parents, the biggest reason was anxiety about not performing well at school because of all the restrictions. So I think that there is this, I want to be my best self. I want to do well. This, it links to another finding in our report, which on the one hand, at first glance, you think they don't, that doesn't line up. But the reality is, despite all these high reported mental health issues and loneliness and isolation, they had the highest rating optimism for the future compared to the older generations. They had more hope that things would get better in the next 2 years, in the economy, in education, in health. My big message coming out of this is, if we don't get proactive with this age group and be there, figure out ways to engage in all the ways and more, I think we'll have to discover, that have been talked about, we risk losing that hope. And also, they had higher trust in some institutions. That's a treasure right now. I mean, we are in such a dismal state of trust in the world. And this age group, despite everything they're going through, do have trust. In fact, they want to have trust. They're groping for trust in institutions to support them. So I think we don't have a long window here, because if they feel abandoned, even in this state, that trust, that hope is going to erode.
And that nicely brings us into the sort of next section that we were going to cover around, how bright is the future? And that observation that young people had such enthusiasm in their future outlook. And what does that mean for us as policymakers and program implementers? And Ashwin, I don't know if you have some thoughts about that. What are you guys doing in New York?
Well, stepping back for a minute, I think Heidi has raised an essential truth, which is growing up and being young is you're preconditioned for hope. What else? All you have is what's ahead of you. And so I quoted the statistics in 2021 of 38% of young people saying that they're hopeless. What we see, if we look at the trend in this same report I referenced, is a steady creeping up. But it's still the majority of young people that don't suffer that lack of hopelessness. So I agree completely, 100%, that we have a window, but our responsibility is not to abandon them. So 2 observations. One is, I think one of the greatest gifts we can give to young people is the ability to navigate the world in its complexity and intellectually, as well as emotionally and socially. And if we continue to kind of keep them on the sidelines, and I know this from my own life, right? My 11-year-old daughter, who may as well be 18 by now, the way she speaks, all she really wants from me is to be a participant in the decision making. And yes, there's times where I just have to, as a parent, say what I need to say, do what I need to do. But she wants to feel like she has a voice. And I wasn't like that when I was 11, but they are. And we've got to accept that as parents and as adults. They want to be at the table. Why? Because they have an alternative information source out there. If you're not giving them the information, if you're not helping them contextualize data, facts, information, messaging, they will find a way to do that. And they are finding a way to do that online every single day. And we currently, these devices and the platforms on them are an unregulated exposure. There are no regulations on what young people can see, do see on these devices. And so what we've done here in New York is to very much make this central to our public health agenda, that social media and the devices on which they exist are a public health issue, and that we need to use the tools of public health, much as we would for environmental health, tobacco control, whether it's harm reduction, education, research, mitigation, legislation, and the like, to try to make these devices and the platforms on them safer, not to take them away, not to snatch them away and return back. They are never going to have the same childhoods we've had. But right now we're throwing them to the wolves. And frankly, there is no business incentive for tech to act any other way than they're acting, which is, what can I do to keep eyeballs on screens as much as possible? Now, there's growing pressure. There's growing pressure. I think the EU is doing a lot better than we are doing here. But even here, we've got bipartisan, and I use that word very rarely, bipartisan consensus that there needs to be regulation. But now, who's capable of understanding what that regulation should look like? Is it adults that are really, frankly, not very sophisticated in our understanding of tech? The most sophisticated people, adults, on tech are all working for these companies, right? The best engineers in the world are at Google and Meta and all these things. So how do we expect septuagenarians, octogenarians in Congress and Senate to actually be making this regulation? So I'm optimistic because we've seen them open up in ways that we don't historically see in our legislative bodies. And so there is strong basic legislation out there, the Kids Online Safety Act here, which, again, while it may feel domestic, does set a floor for international regulation as well, in counterweight to the EU's work, to start to bring some shape to this exposure. The analogy I use is seatbelts. When we built here the national highway system in the 60s, we saw cars get faster and accidents spike and deaths spike. So what did we do? We passed the National Highway Transportation Safety Act in the late 60s and mandated seatbelts. And what we didn't say is go invent your own seatbelt and come back to us when you feel like it. We just saw this week that Meta has put out new child safety regulations. Good, great. But no one's forcing them. They're doing it voluntarily. At some point, we do need to bring in mandates. We need to bring in legislation, regulation, and say, no, it's our job as government to actually bring this under control. And so while we engage our young people in dialogue and listening, we also have to protect them using the tools that we have. And government has a big responsibility there. And so in New York, we have said we'll do everything we can. So we've declared it a public health crisis. I've issued an advisory asking New York parents to not give their young people devices until age 14. We've launched the social media report in June, which is the largest survey of parents and young people on device use and social media use. We have launched guidance and training for schools. We have a digital citizenship curriculum that we've launched with Common Sense Media to basically empower young people to be better consumers of social media in its current unregulated form. And we're in the process of studying and hopefully we'll get to the point of removing phones in schools across the largest school system in the country. We tried it before. Mayor Bloomberg tried it. Mike Bloomberg tried it in 2011. And then it was reversed by his successor. So we got to do it carefully, and we're actually doing a large case control study starting this year. So that's about what we can do at a local level. Ultimately, we need federal and frankly multilateral rules and norms to start to bring this under control.
Thank you. And, you know, Heidi, we at the Global Listening Project will be coming back to a broader conversation about trust and technology and a specific report focused on that. Wame, if I could take you back, or take you forward, I should say, to a positive vision of the future, what stories are young people telling you that they want to express themselves on digital content, but what they want to see in Sugar and in Bloom?
Yeah, if I can maybe just also add an element of where people want to access information. And I think that's also critically important. I mean, I know we tend to focus a lot on the digital side, but that then only targets young people in urban and peri-urban settings. There's also a lot of young people that are still in rural areas and are accessing information in a different way. So I think one critical thing for us to consider is in all of this is not only the stories that we need to tell, but how do we tell them and where people want to get that information from. And so when you dig into the untold stories, a lot of the things that young people also want to hear is prevention for early warning triggers. How do I know that I'm actually getting into point of crisis? Like, what are the early warning signs? What are the prevention methods that young people can actually then learn, be educated on, and be able to then call for help? Because I think what's happening with a lot of our response is that we're already in the mental health crisis when young people, we're telling those stories better than we're telling the stories of influencers, other people who've been able to prevent getting into this crisis. And I think that's where there is a huge, huge gap. Also in diversity of understanding our audiences. We have many young people living many different lives in different areas. We tend to tell the same story over and over again because that's what's popular. More and more, we want to dig into other areas, diverse communities. So, you know, whether the story's been told by geographical context, whether it's being told by, you know, male, females in different circumstances, I think we need to diversify that. So I think two things I would say. One is that the platforms that we're telling the stories, I think needs to change. It needs to be what we call surround sound. So for us is not just about the digital, it's about the radios, about the schools, it's about the peer education and social dialogue at community, because what we're finding as a very powerful tool is being able to show on screen in rural communities some of the content and engaging conversations real time to say, this is the issues. How do you see it showing up in your community? And what does it mean for you as a young person? And then also making sure that who's telling the story matters. So now there's a growing influencer community on social media. What are the opportunities when you talk about the access to the tools? It's also about understanding who is creating the content and how do you use these influencers to change the way that the message is actually being conveyed. I think young people want to see more and more of that coming through very clearly and very deliberately, and to be able to dialogue about those issues. Thanks.
Thanks. Viorica, both Ashwin and Wame have put guardrails on their optimism for the future. How optimistic are you? How bright is the future?
Well, I would like to believe that the future is bright, despite some of the pessimistic data we see. I think there's a room for a lot of optimism, while being aware that this window of opportunity is kind of closing very fast. So maintaining this sense of urgency that something needs to be done. And so we need to acknowledge that a large proportion of adolescents and young people, they're still being optimistic about the future, but we need to be acutely aware that a large proportion of young people are also experiencing anxiety, depression, they're having or struggling with different mental health issues. So we need to be aware of that and we need to act. And from UNICEF side, I think the first thing, few things, just what we think could be done to intervene and in this space. One is empower young people with the information, with the skills, and we talked a lot about that in relation to technology. How do they engage with information, which is an opportunity, obviously, but how do they do that in a way that does not expose them to risk of misinformation, disinformation, exploitation or use, manipulation. So giving them that sets of skills. And UNICEF, especially in the demand space, actively engages and uses these technologies through gamification experiences that we do, but also through the use of such platforms such as Fundu, which reaches more than million young people, adolescents in, I think, 13 countries or so, to develop their skills to understand what's information that they can trust and the one that they cannot, and they receive real-time feedback, which is very good for them. But the other things, I think we repeated it so many times, and I just want to repeat it one more time. Nothing for us without us. Sorry, maybe I'm not saying it exactly right, but listen intently to young people. So UNICEF encourages adults to listen, and I mean that relates to I mean that refers to parents, to families, to communities, and to organizations at large, and encourage them either in private space, because some feel more comfortable. I hope my son does not watch this podcast, I mean, because I spoke about him, but in private spaces and in public spaces, giving them this opportunity and listen to them, give them the language to be able to describe how they feel. The other one is they need to support families, parents, communities through some parenting programs. Also empower them with skills on how to engage in such dialogues, because not many parents feel confident or comfortable, myself included in that. And ensuring that schools support mental health, that they are a safer place, a kinder place. Many children speak about the stress that they experience in schools. Investing in peer education program, because peers play such an important role during adolescence, but also in young children, people. Promote access to good quality mental health services, but also other services around that, social protection, and maybe just to end is to continue investing in data and research. I think that would be because to shed more light on mental health issues, and but also more light on other issues such as trust, what role it plays in the decision-making process, and how we can use that to the benefit of, I think, of children, of young people, but also of the humanity broadly.
Thank you. Good quality data, absolutely. So in a couple of minutes, Heidi's going to just offer some final reflections and observations. And I just wonder, Wame and Ashwin, if you think there's anything that we've missed. Is there anything additional that it's important to participants at the UN Summit of the Future, people watching the live stream around the world, and people who will access this through a Shot in the Arm podcast? What's your big takeaway for them?
And on a somewhat optimistic note, because while there is a great deal of need and these data are essential at unpacking what that looks like, you can see the issues that young people are worried about: education, the economy, their future job prospects, safety, war, climate change, right? These are all pressing political, social, economic issues that we as adults are tasked with addressing as leaders of institutions and societies. But getting back to my previous comment, what young people want is a seat at the table as we're doing so. And we ignore them at our own peril. One of the things that we saw on college campuses all around this country and even globally in the industrialized world, protests over the last year over various issues, but particularly war. And the reflection of some adults that I'm so surprised that the rhetoric is so extreme coming out of young people. Maybe same as it ever was on some level, but I can say this: one of the biggest gifts we can give to young people is the ability to see humanity in others and then use that as a tool to navigate nuance, a skill that they're going to have to deal with and use the rest of their lives. They cannot spend their whole lives being on the extreme, right? And this is what our world is facing around these central issues. But what we do at our own peril is ignore that and say, I can't believe that they're so extreme, rather than saying, how do I actually hear you and help shape this dialogue? And it's the hardest thing to do as an institutional leader over the last year. Creating space for that kind of dialogue is one of the hardest things to do. So I think where I want to end is, particularly for the summit, for the UN, for all of these large and critical global institutions, is what are you going to do to actually create structure, discipline, resourcing, as Waisha said, for youth engagement, moving beyond the performative and the transient, but disciplined, focused through governance and codifying it in your governance, because you have an engaged youth. Either we engage them in the way that decisions are made, or they will engage themselves online and in other forum. And who knows what that will lead to? Maybe some good things, maybe some less good things. So I do think we are big on creating structure and form and function to the way we make decisions in the multilateral world. We better do this around our young people, and we better engage them earlier. And it's something we're thinking about even here in New York City. One of the first things we did when we came into office at the end of 21 and into 22 was launch a citywide survey called NYC Speaks. And a big part of that was youth, surveying young people about what their sense of the world was, what their sense of the city was, and what we could do about it. And around which, here's one insight. They said, we want jobs, we want opportunities to create mentorship networks. So we expanded a program called Summer Youth Employment by hundreds of thousands of kids. They also wanted places to go. So we have all this infrastructure that remains closed on the weekends and evenings in schools, in the form of schools. We said, let's open up all of our schools to after hours programming. Small things, but we heard them, we listened, and it's having positive results.
Yeah.
So I think this is part of and I don't think we know how to do this well, but I do think we have to create a real structure and discipline around how we engage youth and use that feedback to shape programs and policy.
Thank you, Ashwin. Wame, briefly, anything that we have missed?
I think I'll just be very brief and just say that in order for us to build trust and hope, with young, especially amongst young people, it really has to start with destigmatizing these conversations and these issues and really normalizing that. And media has been seen as a very powerful tool in allowing for those conversations to happen. And there's a role for us to play. I think what we need to do better is allowing the stories to be told and put it on screen and giving the young people the agency to be able to deliver that themselves. And I think that's where the starting point is.
Thank you. Heidi, final thoughts?
Thank you. And as Ben had mentioned in the beginning, this has all been live streamed, and we had quite a few people around the world listening in, and we'll be on a podcast. And myself, actually, I'm going to go back and listen to it because trying to absorb it all. I think a few things came up that is really important. I was, before the vaccine work, very involved with Peter on the future of AIDS and engagement, and there wasn't a pandemic that was more about. I mean, I think the saying of "nothing for the people without the people" came out of the AIDS movement, and so I think that's important to learn from. But in the work on AIDS, I'll never forget in our work on the future, AIDS 2031, which will be 50 years of AIDS, we had different working groups. And one of the things that I will never forget is we were going to have a working group of young people. And they said, no way. We shouldn't be off as a group of young people. We are, as Wame mentioned, a very diverse group. You should put us in those other working groups, those content substantive working groups. Don't put us off in a separate working group. And that has resonated with me throughout this work. You said it well. We need to recognize the diversity of young people, and they are very more than ever in some ways, and on the other hand, more clustered in other ways because of social media. Also, what Ashwin said, I hear a lot, particularly around the vaccine work I did, we need public engagement. I said, you don't get it. The public is far more engaged than we are as a public health community. We're just not there. We're not where they are. And I think we as institutions, and I think you've outlined a number of ways New York City is doing this, we as not just in public health, but more broadly, we're the ones who have to get engaged. It's not public engagement in science. It's getting scientists engaged with the public, and flip that upside down a bit. I think that I just want to, in wrapping up, remind people that this is just kindergarten in what is going to be a rollout stage of issue-specific reports coming out of the Global Listening Project. This work has many faces. I mean, as we've been talking about ways to engage and listen to young people, there is a cry for that at just about every age right now. Some of the protests, I watch some of the protests on the news, and I feel like, people, you can give them anything to protest about, and there's going to be, a huge outpouring because it's been a social pressure cooker. It's been the biggest social experiment, which was the conspiracy theory, actually, natural experiment of locking people up for so long with different kinds of restrictions. So the energy is there. That's the good news. It's just, can we make it more positive, productive, or we can't make it, but help channel it. And as Ben said, a huge part of the research that we did was also on trust in technology, not just how people are using it, what are they using it for, and the challenge with that one is that technology is going at lightning speed, way faster than we're catching up with. But we have been in discussions with Google on building a partnership there, and with some other tech companies, to how can we do this collectively to make kind of digital media for good. And just to, I guess, the big thing and the stepping back to why did we found the Global Listening Project, because we felt we cannot prepare for any future crisis if we don't do our own listening to people's experiences on the ground around the world, what they went through, who they trusted, who they didn't, what could have made it better, and get that documented and acted on, because there's going to be another one coming around the corner, and it may not be a pandemic, it may be a natural disaster, and we might have, I did a briefing on this work at the Center for Strategic and International Studies in DC on Thursday with Department of State and CDC and a number of other actors. They were like, we have to also think about polycrises. So whatever we do in this effort is going to help just build societal preparedness moving forward, and just welcome any of you. I know there's a few people in the audience here working on different aspects of the relevant to the work, and we do want to make this part of a bigger collective and consortium of people focused on how can we do a better job and have a more humane next crisis response.
Thanks, Heidi. And thanks to our panel and for the people here with us in New York, also joining us via live stream. It just remains for me to thank our director and producer, Erica Spera from NewsDoc Media. Again, a big thank you to our colleagues at NYU for making all the wheels run smoothly. And finally, we want to hear from you. You'll see on our website in the coming weeks that we will be posting short clips from people offering their answers to two questions. Who did you turn to during COVID? And who would you trust going forward? So if you have access to a cell phone and you want to send us a short clip of your own thoughts, we'd be delighted to hear from you. And you'll find us on TikTok, on Facebook, on LinkedIn, and we'll provide you with all the ways that you can share that with us. And who knows, you may also be on our website. So with, oh yes, now, the UN being the UN, we may potentially have an exhibit inside the UN in one of the basements. That depends very much on whether we actually get to set it up tonight. But if you are a delegate, if you are a delegate, please come by. We would love to see you. So with that, thank you all very much. Have a great week and a safe week, everyone.